Hi, I'm Fatimah and I'm a second year Diagnostic Radiography student here at City St George's University of London, and today I'm going to be talking a bit about my placement experience as well as offering you some advice on how you can prepare for yours. My first placement site was at the Whittington Hospital, and it was the hospital site I was at for the entirety of my first year. What helped me prepare for my first placement was definitely the mandatory and optional clinical workshops that I participated in, and the reason for this is because during these workshops I got very familiar with how to use the equipment within the X-ray room, and that includes how to manoeuvre the X-ray tube, as well as how to use the different settings on the X-ray machine, and also how to move the X-ray couch. But another thing we did during those sessions was we got to practice how to position patients for different X-rays depending on different regions of their body, and that was very useful because it was one of the most important foundations that we needed during placement, so it was definitely very useful before heading out to placement. Another thing we had was a tutorial session by a guest speaker, and she spoke a bit about her first placement experience, and she gave us some tips she used as a student radiographer. I did feel fully prepared for my first placement thanks to the clinical workshops we had at university, as I mentioned before, but some other tips I'd give students to feel more prepared would be just using the things you learn at university from the manual handling sessions. So in first year we did these manual handling sessions where we had different activities to do, and one activity was where we role played with one person being the patient and the other person being the student radiographer, and we just help the patient up from their beds or their seats. And the reason why this is important is because on placement you will actually be helping out patients who find it difficult to move, and so you don't want to strain any part of your body, so that just helps us prevent injury not only for the patient but to ourselves as well. Another thing I'd say is just know all of your anatomy and physiology, because you really need to understand how you take X-rays, and just understanding this gives you a foundation of knowledge that you will use for every X-ray you do, especially your chest anatomy, because it's one of the most common types of X-rays you'll have to do. It's literally an X-ray you do day in, day out, and you'll get really good at them. So yes, and also time management skills are very important, because sometimes you need to practice on placement and also revise for exams. So just having good time management skills helps you have an all-round good placement experience. And then just going into it knowing that it's a very hands-on experience, so make sure that you interact a lot with the radiographers and try to help them out wherever you can. My first placement lasted a duration of 2 weeks, and it was an all-round very enjoyable experience because I got to ask the radiographers any questions that I had, and I also interacted with a lot of the healthcare professionals within the multidisciplinary team, and that's always very exciting. I kind of used the first week to understand and observe the way in which the radiographers communicate with patients, so that during the second week I could do so myself, and this included calling patients in from the waiting area and getting their IDs down, and doing so in a very professional manner. I'd say the best parts of my placement were interacting with different healthcare professionals within the multidisciplinary team, from advanced practitioners to senior sonographers, as well as doctors and nurses, because it's always very interesting to know the different roles that people perform within the radiology department. Also, I really enjoyed being rostered to different imaging modalities, such as nuclear medicine and theatres, because it's so interesting to see how radiography is used for different settings and environments, and how it can help us in so many different ways. I also enjoyed learning different techniques from radiographers, because they all have different techniques they use based on the specific injury that a patient has, so it kind of goes beyond the theory you learn in lectures. And yeah, I really got to develop so many skills, such as team working skills and obviously improving communication skills as well. The least favourite parts of my placement experience were adapting to different environments, because at first it can be challenging, not only with different environments but also different patients. It's something you really have to get used to, but as you practice you do get better at it. But also it was very difficult to see patients at such a low point in their lives, because as a student radiographer, there's only so much you can do to help them. So it's very upsetting to see patients in A&E and just struggling with their health, with different conditions. During placement, we did have a lot of support, because on the first day we went in, we had a tour of the radiology department, and that really helped us kind of figure our way around during the rest of our placement. We also had an induction booklet that we were given, so it kind of prepares you for what the hospital that you're specifically at is expecting from you as a student. We also had very regular link lecturer meetings, and this is where you kind of meet up with other students within your cohort, within your hospital, and you kind of discuss any concerns you have, as well as any questions you might have with your link lecturer, and they're always very useful. In my first year, I was placed at the Whittington Hospital as well as Wood Green Community Diagnostic Centre. Cooperating with different healthcare professionals within the multidisciplinary team, more specifically qualified radiographers, really enabled me to understand the importance of effective communication skills, and that just further developed my confidence, because I got to see so closely how the radiographers navigate through different issues that they may have. For example, if a patient has learning difficulties, or if there's a language barrier, or the patient has a very difficult injury, it's very important to know how to adapt your technique, and just observing that really helped me as a student. But also, your confidence does develop further when you are interacting so closely with patients, calling them in to have their ID checked and explaining the procedure to them. My favourite placement experience was definitely working at Wood Green, because it was a very slow-paced environment compared to the fast-paced hospital environment. So you do really get to practice your x-rays, and before you call the next patient in, you have time to ask the radiographers for feedback on what you did well in your x-ray and what you can improve on, and that definitely helped me long term. So if you do have any spare time between patients, I'd recommend you do the same. So if you're about to go on placement, some advice I'd give you is just make sure you know your basic anatomy and physiology, and just focus and prioritize learning rather than what you don't know, because you don't want that to take away from the fact that you're on placement to learn. And radiographers are always there to help you, they're supervising you, so there's nothing to worry about. And yeah, just ask questions and enjoy the experience. I hope this answered some of the questions you may have had about starting placement. And yeah, I hope you enjoy your placement.